So how long does healing take? Well, healing is a process, a threefold process. The first step is called inflammation. This is when cells and blood rush into an area to inflame, to make a tissue grow, to bring nutrients and cells into that area to promote repair. After inflammation comes what's called proliferation. Cell types begin to multiply. They begin to grow. The last part is called remodeling, when these cells that have grown and that tissue that has grown begins to organize itself into a healthy way, into a strong, viable tissue. Now, a healing procedure such as PRP can take weeks to months to go through that entire process of inflammation, proliferation, and remodeling. Stem cell procedures can take months to go through that whole process. Now, the important thing to do during that process of healing is to rest. In that beginning phase of healing, inflammation, you really just want to rest. Just like if you just sprained your ankle, you wouldn't walk on it. This is what you want to do in the very beginning of a procedure. You just want to rest. If you could sleep 20 hours a day, that would be great. But you don't want to put too much stress on that inflamed and healing joint. A few weeks go by, 1 to 2 weeks, you go into the proliferation phase. In this phase, you try to return to normal activities, full range of motion in the joint, doing the day-to-day activities that you were doing before the procedure, but not exceeding or increasing your pain level. The last part is called remodeling. And again, this takes place at weeks for PRP or months for stem cells. During this phase, you begin to do focused exercises that help to organize the tissue into the strongest fashion. So the take-home point from this video is that healing is a process. Going through a regenerative procedure is not a magic bullet. It's not taking a magic elixir or potion. Although it's very potent, it takes time. And true healing takes time because there are two. You could look at it as, to look at healing in another way, it's really a twofold process. The first process is the control of inflammation. When you have an injury in your spine, in your knee, the part of your body that's causing pain is inflammation in that joint. That inflammation is causing nerves in that area to trigger pain and sending those signals to your brain. Now, a PRP or a stem cell procedure immediately during that inflammatory phase will regulate that inflammation. It'll control it. So a few weeks after a procedure, it's not uncommon for all of the pain to go away. That's called the pain-free state. Now, the trick to long-term healing is when that pain-free state has been achieved, that you stop doing too much on that joint, that you extend that pain-free state as long as possible. Because once that pain-free state is achieved, the second part of healing, the regrowth phase, begins. And it's during that regrowth phase that you really get long-term healing. So you want to extend that pain-free state as long as possible and always err on the side of caution with increasing activity levels and discuss with your doctor for an optimal and long-lasting healing response from a regenerative procedure.